Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now today's topic is about diagnose, fibroids diagnose. Hello, Alexandra, nice to meet you. Now today we're going to talk about how are fibroids diagnosed. Thank you for saying hi to me. Now, please say something to me, say hi to me if you're on Facebook or Instagram, or if you are on YouTube. And please share and like. Hi Veronica, good morning. Thank you, I'm doing well, thank you. Hi Eric. Nice to meet you guys. Thank you. Now, how are fibroids diagnosed? We talk about the symptoms yesterday morning, right? Can we what do you think? Can we diagnose fibroids to the symptoms? If patient come to you say, well, I have heavy bleeding between period or during period, can, according to that, or pain as well, severe pain during period, can you give a diagnosis of fibroids? Can you do that? Certainly we can, right? So what is the proper way to diagnose fibroids? Then the symptom of fibroid is bleeding, right? Irregular bleeding. It can be spotting, can be heavy bleeding between period or during period, or the menstruation that lasts longer than usual. The menstruation may be 10 days, 3 months, and stopping. And the pain could be in the tummy, could be in the lower back or groin, pelvic area. The pain comes and goes, or pain today all the time. A bloating, pressure, fullness, and lower abdomen. When you look at those symptoms, can you tell, oh, right, you have suffered from fibroids? Now you can. Because heavy bleeding or bleeding is unstopping, it doesn't mean you suffer from fibroids, right? Blood test to verify the female hormone level. Yeah, that's one thing. Need ultrasound. Yes, ultrasound. That's right. Basically, you just look at it. You just look at it. Yeah, that's right. Now, pain during intercourse is one of the symptoms, but it's not just pain during intercourse. It's not just fibroids. It can cause from inflammation of pelvis, or it can cause from endometriosis, right? So pain, bleeding, heavy bleeding, bleeding longer, or increase in urine or frequency, quite often urination because of the fibroid, compress the bladder, or constipation because of fibroid, compress the intestine. All this symptom if you suffer from fibroid, you may have it, but it doesn't. You can't put it all together and say, well, you have fibroid. No, you can't. Okay, because there are a lot of women that actually suffer from fibroid and without any symptoms. Does it make sense? Okay, therefore, for proper diagnosis, you will need to see a gynecologist, right? And to get a pelvic exam. Okay. And this exam is used to check the condition, size, how big is that, and shape of the uterus. You may also need other tests like blood tests. Then ultrasound is the most common for diagnosis of the fibroids. So there are two different ultrasounds. One is just through a tummy to look at what's going on inside, and the other one called transvaginal ultrasound, which is in which the ultrasound wand is inserted into the vagina. Okay, so it actually it actually provides a much clearer picture. Okay, so there's a bit different between that, and that is another thing that your doctor may suggest you is a pelvic MRI. So apart from ultrasound, you may get pelvic MRI. Okay, so those are two things that to diagnose. Okay, I remember when I was with my master in China. Well, he's doing seeing a lot of patients, like in Chinese medicine, in doctor in China, they do Western medicine, Western doctor job. Okay, what I mean that is they have to do surgery. They have to give prescribe Western medicines. Okay, so every day, and he sees patient, and he need to give them pelvic checking. Okay, and way back there, China only allow one child, and he actually need to perform abortion for patient. Okay, so it was horrible. I've seen all this. For ultrasound, the doctor not actually doing it themselves, and actually refer to others technician to do the ultrasound. Okay, and the MRI as well. Okay, but the pelvic check examination, then the vagina examination, then he did a lot on a daily basis that he need to do that. Yeah. Hi, happy day. How are you? Okay. Now it's pretty simple today. The basic things is to proper diagnose is using ultrasound. Okay, that is the only thing to diagnose it. Okay, to be honest, because we can diagnose through the symptoms. There's no way to diagnose through symptoms, because all the symptoms it can cause some other disease, other problem. All right, so there's no way for us to tell from patient if they come and we just look at the symptom and say, yes, you have fibroids. The only proper way is get ultrasound or pelvic MRI. but normally ultrasound will be fine. Then you just work back from work. Thank you. Then I want to share with you that the other type of diagnosis using palm. It's over here. So it's between here and here, over here. So over here, this one, if it's got island on it, then what happens if it's got island on it? You can diagnose the patient have fibroids or PCO, polycystic ovaries, right? But it doesn't mean that the patient will definitely have fibroid or PCO. Okay, so we used it here to diagnose, to help us to diagnose. You look at the symptoms and you look at here, and they say, well, you have high chance of fibroids or PCO if they have an island, a few island in here. I mean, island is the crease. It actually form an island shape over here. Okay, that's what we do. Okay, so but I've seen some patients that I told them that they may have some. They said, no, I don't have any, because what happened is we know PCO and fibroid, they if they suffer from it, they haven't done any test like ultrasound to look at it, and they have no symptoms. They have no symptom, periods normal, no bleeding, no pain, you know, so they never know. I never know, but we can tell from here. Okay, we can tell from here. All right. And ultrasound is not 100% be able to diagnose properly, but yeah, it is the only way we rely on it. I want to share with you that I have patients who has 3 months of bleeding, and she done ultrasound and didn't pick up anything, no fibroids, until they talk about, well, 3 months of bleeding every day, that's too much, and she was so weak, and they say, well, we're gonna suggest her to do a hysterectomy, remove all the uterus. Then before that, they did another scan of ultrasound. They have this very small one, a small fibroid, just one. It's that one, that was the one that causing bleeding for 3 months. They remove it, just remove the small one. Ever since that, no bleeding, no bleeding. So ultrasound, you see, missed in the first place, but luckily pick up on the second time, right? And just a small one, it caused bleeding every day for 3 months. That's horrible, isn't it? Yeah. So I want to share with you a few that can help you, the conditions together, the symptoms, and this may help you to understand whether what's going on with the bleeding if a patient comes to you. Okay, and of course ultrasound, yeah, and ultrasound may miss it as well, so you need to know all this thing. All right, that's it for today, and it's a very short topic. Tomorrow we're going to talk about treatment, you know, fibroid treatment. What sort of treatment can we do? What? Okay, we're going to talk about Western treatment, and we're going to talk about Chinese medicine treatment, acupuncture treatment, then acupressure treatment as well. What can you do at home? Right, something like that. Happy Day said the patient complained to me that she can't have sex because her vagina is too tight. What can be the causes? I have no idea. I haven't had any complaint with that, and I haven't had any case for that, and I never thought about that. Yeah, I may have to think about it. Okay, now if you have any idea, or if you have any experience, or any treatment that you do for this case, happy days, a patient complained to me that she can't have sex because her vagina is too tight. What can be the cause? I have no idea, to be honest, but I think maybe the treatment over here, because I know in the cosmetic acupuncture, they did needles over here or in here to actually tighten the vaginas after birth. Okay, I haven't learned this technique yet, to be honest, but acupuncture comes with, on the point, you can make things like you can tighten it up, you can loosen it up as well. Okay, so if it's tight, and maybe here the muscle somewhere tight, and you can just loosen up. This patient has fibroid. I'm not sure about whether fibroid. I think maybe this patient, I don't know, because I have no idea about tight vaginas. It's about the pain. Okay, so if the pain, they have pain, then you want to do is because fibroid causing pain. Okay, and you need to find out where are the fibroids exactly. Okay, and how many do they have? Whether the fibroid causing the pain. And the patient, of course, you say is tight, too tight, but actually she may have just had fibroid. The fibroid causing the pain. It's not exactly too tight, it's the pain. Okay, they prevented to have intercourse. Now I want to ask another question is, does this patient always had these issues, or ever since she has fibroid? That maybe need to find out this, be able to judge what's going on. Does it make sense? Yeah. And otherwise, I don't have experience with treating tight vaginas. Okay. Thank you. Well, very good question. I'm sorry I didn't have the best answer for you, but I'm just telling everyone what the question was. Every day she asks in Instagram, but if you know any answer, or if you have any suggestion, please put it down there, and I would. She has done operation before. Operation for what? Fibroids or operation for tight vaginas? The operation for fibroid, and this a fibroid will remove. Let's say fibroid, is it just one fibroid, or all fibroids removed? Has she has these conditions before fibroid, before operation? Is this tight vagina thing has been ever since the fibroid, ever since the operation, or she has it all the time? Because all removed means all fiber removed, right? Or that only happened after operation. So then that is abnormal. Then that's abnormal things. Okay, so it can cause after the surgery, right? Then yes, acupuncture will be able to tell. Now, let me give you a thing, a suggestion. If you lay the patient down, put both legs across the back, right, and you pull both legs together. Pull it to that way. Okay, pull it ankle, and you put it together and see which side is shorter. In this case, this side is shorter. This side means well, whatever. I don't want to say side because left or right, because when you look at it, you may look at the opposite side. If that side is shorter, right, shorter leg. On the shorter leg, you go to the groin, and on the what do you call it? Liver meridian. I don't know the point, okay, because the point may be different with. I don't know the English name because it's called Indian and Juuli. Indian Juuli over here. Indian and Juuli point on liver meridian. So they are very sensitive. Remember, there is an artery in here, and you don't want to hit it. So you use your hand to press it. If you get the muscle, there's a very tight muscle in here. Everyone have it, and you press it very sensitive. You use long needle and stimulate the point. To stimulate a few times, it can go for 5 to 9, or it can go for 18 times, in and out, just in and out. Then release it. You don't have to leave the needle there, just take the needle out. That's it. Okay, and try that way. Do it on this shorter leg. Okay. So leg, if they're uneven, one side is shorter, do it on the shorter side. Don't do it on the longer side. Okay. That's according to TE acupuncture. I hope that helped. All right. Stay awesome, and I love you all. See you. Bye bye.